vulnerable.
She is bedbound. She can't feed herself. She can't move her feet.
And victimized.
It makes you sick, doesn't it?
In a place supposed to keep the defenseless safe.
You have a culture over there that it's okay to abuse these people, and that's just not right.
Tonight, a family demands answers from a nursing home claiming repeated sexual abuse went unreported.
There's no way to track down how long this has been going on.
And the choice here was to cover it up, not to report it, pretend it's not happening.
The nursing home in Cashmere is accused of allowing a man to sexually abuse fellow patients again and again.
Como 4 investigator John Humbert is here. And John, we're all wondering the same thing. How could this happen?
Well, that's a great question that is all the more perplexing because the reports say that nurses and staff witnessed a number of cases of a patient in the dementia ward sexually abusing other residents. The family, experts in the field, and even a state senator say this nursing home should have been stopped. Tucked away in central Washington near the winding Wenatchee River, Cashmere Convalescent Center calls itself a special place for those in need.
You are responsible for this adult. People are paying and they expect you to take good care of their family.
For Linda Freeman, it's become something else.
Are you okay?
Freeman invited us to go inside her sister's room in the dementia ward to see her condition.
She is bedbound. She can't feed herself. She can't move her feet.
She has trouble communicating, is nearly deaf, and can barely speak. We aren't saying her name or showing her face because of what happened earlier this year. Without that state worker coming to you and sharing this information with you, do you think Cashmere ever would have told you that your sister was sexually abused?
No. No, not at all.
The sexual abuse is spelled out in a report obtained by the Como 4 investigators put together by state and federal agencies. The abuse started in mid-January between a man known as Resident 1 and Freeman's sister, seen here as Resident 3, both patients in that dementia ward. The report said that a housekeeper saw Resident 1 standing over Freeman's sister with his jeans around his legs, holding on to her hand and forcing her to touch his genitals. She wasn't able to call for help, fight back, or even move.
It makes you sick, doesn't it?
The housekeeper hollered at him to stop. The director of nursing was told, but no one outside Cashmere Convalescent Center knew it happened. The center did call Freeman, but only about her sister suddenly losing weight.
And I said, you call me and tell me she's not eating, but you can't tell me why she's not eating.
While that was the first case, the report says that the abuse kept happening to other patients. Cashmere staff witnessed Resident 1 pull another patient's hands to his groin, but that a nurse did nothing other than to make eye contact with him to get him to stop. He also tried to get into Freeman's sister's room 2 more times until she was finally able to get staffers to understand that Resident 1 was sexually abusing her. The report says the director of nursing services viewed what was going on as nothing more than consensual activities between dementia patients. The man kept making advances, yet the director said, quote, "There isn't anything we can do until he crosses the line." How does that not cross the line?
All they had to do was call the state.
What finally made that happen? On February 2nd, a staff member saw Resident 1 take the key to the dining room, followed him there, and found him fondling another dementia patient's breasts. The Como 4 investigators obtained that police report and 911 call with Chelan County.
That he's getting more and more sexual with some of his exploits.
In the end, they transported him to the hospital for a medication adjustment, not to treat him for the abuse. He's believed to be at Central Washington Hospital in Wenatchee.
I actually brought them in.
When we visited Cashmere Convalescent Center, operator Bill Dronin showed up. He'd already declined our request for an interview. Freeman lit into him.
Your aides could have called when this first happened.
Should have.
We pressed him for more.
That needs to be done more here.
Here? Why?
Dronin admitted to us off camera that he was remorseful and that none of this should have ever happened. An apology is one thing, a punishment is another.
That's illegal. And so we need to do further investigation.
Senator Barbara Bailey chairs the legislature's Committee on Aging and Disability. She was disturbed by the situation at Cashmere and how the abuse went under the radar.
Mandatory reporting is extremely important. It is the law.
Prominent elder law attorney Mark Kosharadsky dismisses any talk of consent. After reading the reports, he believes not reporting this was deliberate.
And the choice here was to cover it up, not to report it, pretend it's not happening.
Investigations into nursing homes are handled with both the state and federal governments. The state licenses the facilities. The feds award Medicaid or Medicare money to them.
That situation is horrific.
That's federal investigator Stephen Chickering speaking by phone from D.C. about the Cashmere report. It found the center violated mandatory reporting rules, that it, quote, failed to recognize the behaviors as sexual abuse and did not act to protect residents there.
So what has happened is you have a culture over there that it's okay to abuse these people, and that's just not right.
Handing out punishments for those findings is up to the state, DSHS. Options include suspending or firing staff members, fines, even shutting the place down. Instead, DSHS ordered Cashmere to write proper policies for recognizing sexual conduct and consent, something the law already requires. The center promised to increase staff training and that Cashmere had to pay the feds $6,300, a fine that's less than the rate to live 1 month in the Cashmere Convalescent Center.
And they're pushing paper and they're just slapping the hand.
Maybe it's not a crime to do it to a demented person because their mind is gone. That's how I feel the state is telling people. I don't believe that.
One sister simply trying to protect another.
I just want her happy and safe.
And that didn't happen.
No.
Now, the state refused our multiple requests to sit down and explain this decision or justify why this punishment is enough. But Senator Bailey, who you just heard from in the story, wants this case reviewed again. And it's tougher for the state to say no to her. We're going to stay on this, too, every step of the way. We've also posted every single document and report we've uncovered for you to read. That is all right now online on KOMOnews.com. John Humbert, KOMO 4 investigators.
The state is taking immediate action after the KOMO 4 investigators exposed cases of sexual abuse inside a nursing home dementia ward. John Humbert broke the story yesterday. He joins us with the latest. And John, this really has the state's attention, doesn't it?
Yes, it does. We can confirm that after we started asking questions, the Washington Board of Nursing Home Administrators decided to launch an investigation into the owner of the Cashmere Convalescent Center. The Department of Health told me this afternoon that no one in the agency knew anything about sexual abuse of dementia patients until we told them.
It's a story that still doesn't seem real.
Come on in, she's sleeping.
We first told you yesterday about a bedridden dementia patient who can barely speak or hear. She was one of several patients at the Cashmere nursing home who were sexually abused by another resident. Staff and housekeepers witnessed it multiple times earlier this year. The head nurse called it intimate consensual activity. A joint Department of Social Health Services and federal reports called it sexual abuse. The biggest punishment in all of this was a $6,300 fine. While putting together our story, we wondered if this punishment went far enough. We asked the Department of Health to take a look at the state investigation and weigh in.
Are you okay?
Today, we learned that that was the first time the agency knew anything about the incidents at Cashmere.
We are not going to tolerate this anymore.
DOH passed the report from the Board of Nursing and on to the Board of Nursing Home Administrators, the people who license owners of places like Cashmere.
Your aides could have called when this first happened.
Should have.
The result? There is now an active investigation into operator Bill Dronin, who we met earlier this month. He's declined multiple requests for interviews. The health department can't speak with us because they're still gathering information on Cashmere, but they said it could be completed in weeks or even months.
Now, 15 minutes ago, I got an email from DSHS, the folks who put together that original report. They initially had told us about a month ago that they had given it to the health department. Turns out that never happened, a violation of their, quote, standard practice, according to the email. They finally shared that report today with the health department again after we started asking questions. John Humbert, Coma 4 investigators.
Been 2 weeks since the Coma 4 investigators first exposed repeat incidents of sexual abuse inside a nursing home. And a prominent leader in the legislature now says it's time for accountability. Coma 4 investigator John Humbert has his call to action. John?
Well, last month we uncovered multiple cases of sexual abuse in the Cashmere Convalescent Center's dementia ward. We also revealed how the state's own system of investigation broke down along the way. Now another lawmaker has joined a growing chorus saying enough.
I hate these stories. I just do. They're wrong.
State Representative Joe Schmick has seen enough. It's time for change.
I'm shocked. We've got to do a better job.
Schmick spoke to us in his Olympia office after watching our reports uncovering what happened to Linda Freeman's sister.
He came into my sister's room
earlier this year at the Cashmere Convalescent Center. How staff knew about a dementia patient sexually abusing other patients in the same wing, but failing to report the conduct to the state, following up with care for the victims, and even calling the multiple incidents of abuse consensual.
This was consensual? How can someone with dementia have consensual sex?
Schmick is the ranking member of the House's Health and Wellness Committee. Beyond his disgust with what happened inside the nursing home, he's outraged that the Department of Health had to find out about this from us instead of the Social and Health Services Department, DSHS.
What does that say to you about their ability to investigate?
I think we'll get to the bottom of this. These are questions that are pertinent, that need to be answered.
That man.
Those questions keep coming. After we told DOH about the abuse and how it was handled, it launched a new investigation. And Schmick held a closed-door meeting with higher-ups from DSHS, the Health Department, and other committee members.
We have to know exactly what happened, what was reported, how was it reported.
Schmick says he wants real results soon, not just talk. Few details this early, but he does, quote, expect changes. There still could be hearings about the investigation lapses and the small fines and punishments handed to Cashmere, which families call weak.
Your aides could have called when this first happened.
Should have.
Schmick isn't done yet.
This is a problem. We're going to try to do our best to make sure that we have a good resolution to it.
Now again, as far as those punishments Cashmere faced, it was a $6,300 fine, education classes for staff members, and they had to write new sexual abuse policies for their handbook. The Department of Health's nursing administrators still have an open investigation into the owner of Cashmere. That case is still pending, and much more to come on this.
Incompetent, negligent, and potentially responsible for death. Those are the allegations made in a lawsuit filed today against the Cashmere Convalescent Center. The Coma 4 investigators exposed the center's failure to prevent the sexual abuse of patients in the dementia ward. Investigator John Humbert joins us live in our satellite center. And John, tonight, one family is taking action.
Very serious action. They've been in pain since they learned of the sexual abuse of their sister. Then last month, they had to lay her to rest. Even before her passing, the search for justice was already underway.
I just can't believe that it happened.
Linda Freeman has fought so hard for her sister. Years of battling medical red tape.
Oh, what happened to your nails?
Her sister's deteriorating mind and body, and now a fight in the courtroom.
Are you okay?
Earlier this year, we revealed the abuse of Freeman's sister at the Cashmere Convalescent Center. State investigators said the nursing home allowed one patient in the dementia ward to sexually abuse multiple patients.
You're welcome.
Including Freeman's sister, who is bedbound and can barely speak.
She laid in that bed, frightened to death that this would happen again. It was just horror.
Attorney John Thomas represents Freeman. He alleges the center suppressed and concealed the abuses and that the staff was unfit, unqualified, and incompetent. A large part of the case rests on the nursing supervisor who told the state that the sexual abuser had rights to pleasure that could not be denied.
Including sexual satisfaction and intimacy needs. When I read that, I was shocked.
Freeman and her siblings couldn't speak today because of their grief. They say that since the abuse in January, their sister's health worsened with depression and a 30-pound weight loss.
That downturn was rapid, and ultimately she passed.
I'm having a lot of trouble.
As this civil case begins, the Nursing Home Administrators Board is still investigating Cashmere owner Bill Dronan. The federal government fined the center $6,000 for the abuse. The state only required a rewrite of policies and more classes for nurses. Thomas said there needs to be more punishment.
They were required to be proactive. They were required to notify the family. They didn't do that. They were required to put this man in isolation. They didn't do that.
A family in mourning and a failure of care still unresolved.
And if you can't live up to that duty, don't be in this business.
So far, the Chelan County Sheriff's Office has been very tight-lipped about the status of any possible criminal charges for any of the staff members. It's still believed the abuser in this case is in care at a hospital ward in Wenatchee. Operator Bill Dronan did not return our call today for comment. Live in the Satellite Center, John Humbert, KOMO 4 investigators.